Hi, everybody. Welcome to Healthline. I am Gregory Zarin. For the past 4 years, we spent a lot of time sharing with you affairs of the heart, how to be healthy, how to keep your heart healthy, what you need to know, what you need to not know, what to put down, what to start, what to stop. We've also spent a lot of time talking about you and your vascular system. Well, Glendale Adventist Medical Center, the Lee Hughes building, is proud to announce the Heart and Vascular Institute. Everything you need to know about you, your heart, and your vascular system. 10 amazing exam rooms, a treadmill, an echo room, and let me share with you a few of the amazing treatments you can get here. Treatment of heart failure, treatment of valve disorders, treatment of coronary artery disease, chronic care management, cardiac and vascular primary screenings, population health screenings, nuclear camera, treadmill, echo room, the list goes on. So if you have any questions about you and your heart, you and your vascular system, you wondered where you had to go? Here is the place. Spend this half hour with us and learn everything you need to know about you, your heart, and your vascular system. Do not go away. Hey everybody, welcome back to Healthline, and today it's all about affairs of the heart. Here we are at the Lee Hughes building, Glendale Adventist Medical Center, and on the second floor, it is the HV Institute, the Heart and Valve Institute. Joining me are interventional cardiologists. To my farthest right, Dr. Head Ahmadpour, who just got out of surgery. Very exciting. And right next to me is Dr. March Landenheim. How are you, doctors?
Very good.
Was it an exciting surgery?
It's okay. Yeah.
It's okay?
Yeah.
And you have a heart on your lapel. Love that. So, doctors, talk to us about interventional cardiology. What does that mean? What is that?
Well, there are different forms of cardiology practice. There's interventional and non-interventional cardiology. Non-interventional is where we try and identify heart disease, treat risk factors, basically keep people actually out of the hospital, away from the laboratory, where we do interventional work. Interventional work is where we actually look at the arteries, shooting dye and contrast into the vessels. And if we see blockages, we can open them up, sometimes with stents and balloons. Sometimes people need bypass surgery. But we are investigating the heart by going through the skin into the vessels and actually looking.
How common is cardiovascular disease, doctor?
Cardiovascular disease is number one cause of death in the United States.
As I was doing some research. Please go ahead.
And worldwide is actually increasing in a lot of third world countries, like in China, in India.
Why is that?
It's because of the stress, because of the lifestyle modification. I mean, it's multifactorial.
And also a lot of diet.
Well, we're bringing the Western diet to other countries.
As I was researching today, I came across these stats. 1.5 million heart attacks and strokes each year are associated to cardiovascular disease, including heart disease and stroke. Every day, 2,200 people die from this disease. That's nearly 800,000 Americans each year, 1 in every 3 deaths.
That's correct. It's actually, as we speak, every probably minute, we lose 3 to 7 cardiac death. These are the people who have never knew that heart disease, that they die suddenly. So then
here's my question. We hear about it, we talk about it, we know about it. What can we do to prevent heart disease? It runs in families, so we have to make sure that it's not in our family history.
Well, you can't change your family.
No, but you can change what you do in regards to the health of your family.
The more likely, the greater your risk. Say you have a family history of heart disease. You're at higher risk of having a heart problem. So you need to be more concerned about your risk factors and controlling them than others even. But everybody should be concerned about their diet, about eliminating fat in the diet, sugar content of the diet. Exercise is critically important.
So, doctor, let me cut this down to Dr. Ahmadpour. When Dr. Landenheim says fat, what is fat in the diet?
Well, but before I say that, is actually the heart disease is a very complex disease, and there is a lot of unknowns, and is a multifactorial. Not that we know every factor about the heart disease.
Sure.
So when we say, like, for example, genetic falls into a very huge category. We have detected almost 250 genes.
Okay. But
hopefully in the future we'll be able to modify it. But when we talk about fat specifically, we're talking about, we want to have monounsaturated fat, the kind of fat that you get from olive oils, from fish. We don't want to have saturated fat. Fat, which is like butter, which is like when you fry things, is not good for you. So the latest recommendation by American Heart Association is Mediterranean diet.
What is?
I would love everybody to Google that, because I can go into it. But basically, when you go, Mediterranean diet is a multigrain sort of kind of diet. They have lean meat. The style of cooking is like baking, like steam cooking, is not frying. And it's available on Google. If you Google it, they give you the detail of diet and how you prepare it and what are the ingredients.
Okay, so you just got the doctor's orders. Please Google the Mediterranean diet. And what's great about being in this culture here locally, it is very Mediterranean. It is very Middle Eastern, where I think it's a dichotomy. We can specialize in that type of diet, but then we go to the other side and do too many fats. We smoke too much. We drink too much. We don't exercise. Dr. Leidenheim, what do you say to someone that doesn't do any of that?
Well, they assume the risk. You encourage people to change their lifestyle. But if you smoke, you're at risk. If you have a poor diet, you're at risk. I think it's important that people understand that they can make simple modifications and improve their outcome. In fact, there's very recent data of the past week where they're talking about even standing for 10 minutes out of the hour lowers your risk. Even 30 minutes of exercise a week lowers your risk. So you don't have to become a marathon runner. You don't have to become a vegetarian to change your risk. So I think people have to find what's good for them, what the right level is. But there's a lot of hope here, and there's a lot that can be done. But it requires, I just want to back up for a second.
Please.
There are all these deaths from heart disease. Unfortunately, most of them occur in people who don't even know they have a heart problem.
So then how do you find out you have a heart problem?
Well, you have to be in the system. You need to know what your blood pressure is, what your cholesterol is. You need to pay attention to your family history, smoking. And we can identify risk by accumulated risk factors. And we can tell you, well, what's your prognosis? What are your chances of having a heart attack or a stroke in the next 10 years? And so it gives you a target, gives you a starting point, and then you can work at lowering your risk. And it's very possible for everybody.
I love that you said get into the program. Please, doctor.
I just want to follow up on him.
On me?
On his answers, which is wonderful. Is just, remember I talked about sudden cardiac death?
Yes, you did.
So patients who are at the risk of sudden cardiac death usually have what we call minimal plaque. In other words, the artery is just minimally blocked, and that's a tragedy of it. And with all the techniques that we have, you cannot identify patients with minimal plaque. In other words, we can do it scientifically, but it's not a standard of care. So here you got a patient who's walking in the street who looks very healthy. So what really is usually leads to vulnerable plaque is what exactly Dr. Leidenheim discussed. Risk factors. So by modifying your risk factors, which is gene, which you cannot modify, family history, unfortunately you can, but high cholesterol, blood pressure, smoking, stress. I can't overemphasize stress. I think stress is a major, major risk factor. You can actually modify the chemical structure of a plaque and prevent sudden cardiac death. And actually there is multinational studies now leading by our chief of cardiology at Mount Sinai Hospital in New York that is studying all over the world for aggressive risk factor modifications in about third world countries to prevent sudden cardiac death.
I love that. Thank you. Last question, doctors. Heart and Valve Institute right here in Glendale. How exciting is that for both of you? Because it's one of a kind here.
I think it opens up the opportunity for people to get care when they did not know where to go and they did not have the resources to do it. And this is an opportunity to try and help the community, help themselves.
Doctor?
Well, I think in addition to that, I think it's a very comprehensive cardiovascular center where you can do basically anything and everything for all kind of heart disease, from preventive care to most complex cardiovascular disease, congenital heart disease, and all kind of heart disease here.
And I lied. Final question. What is your number one heart health tip?
Exercise.
Love that, doctor.
Lower your stress.
Okay, so this is what we're going to do, doctors. Thank you so much. We're going to take a few deep breaths in and out. As I say on Healthline all the time, breathe in and out. And here's the deal. If you're at work and you can't walk around your building or you can't go for a run, stand up for 10 minutes. You heard it here on Healthline. Don't go away. We will be right back. Welcome back to Healthline, and it is Affair of the Heart Day. And as we just discussed, standing up for 10 minutes an hour can help reduce your risk of heart disease. Same thing with exercise, quitting smoking, eating healthy, drinking lots of water. You are in control of your health. And as Dr. Leidenheim said, get into the system. So there's a lot to this ticker, and we're here to bring you more information. Joining me now are vascular and interventional radiologists, Dr. Denisan and Dr. Shadi Shaheen. They're going to share with us what we need to know more about what that means. Welcome, doctors.
Thank you.
Thank you. What does that mean?
Well, vascular and interventional radiology is really a specialty that has evolved over the last 30 or 40 years. It is a specialty that has truly benefited from some of the advancements in technology over the last several decades. We've embraced it, and frankly, we've been able to expand the treatment options to patients for whom there was not a whole lot available, either no treatment or incredibly morbid surgery. And through that, through minimally invasive procedures, we have been able to improve the patient experience and again expand the range of treatment options to many and all patients, and especially those at the fringe who previously were not candidates for traditional therapies.
Thank you. Backing up just a little bit, what is interventional radiology? What is that?
So basically what it means, it's a subspecialty in radiology where we use image guidance to allow us to perform procedures to allow either diagnostic or treatment options for patients with image guidance and minimally invasive options.
So when we're saying interventional, that means to stop it before something happens, yes?
Yes and no. So if you look at the traditional dichotomy of radiology, you have diagnostic radiology.
Break it down for me really quick. Break it down for all of us. What is radiology?
So under the umbrella of radiology, you have imaging. So
Okay.
CT scans, X-rays, ultrasounds, MRI, so on and so forth. And the specialists who interpret those studies and help the clinicians arrive at a diagnosis and decide on a treatment path are the diagnostic radiologists.
Got it.
Separate from the diagnostic radiologists are the interventional radiologists who specialize in minimally invasive procedures. So what can distinguish us from other specialties who may perform invasive procedures is that we are specialists in imaging. So we come from a background of being specialized in the interpretation of, again, X-rays, CT scans, ultrasounds, etc. But we apply that to treatment. So previously, when you had open surgery, the surgeon would create the incision, open the patient, and be able to see the pathology. Now we're working.
I loved. Do you like that? This, look. But now you don't have to do all that.
But now we
Minimally
do most of our work through a single 1 centimeter incision. But of course, we don't have X-ray vision, so we need to rely heavily on the imaging modalities, and you really have to be an expert in interpreting those real time in order to be able to get the best results.
Are there moments where you find it more beneficial to actually open someone up and see?
Sometimes, and this has been evolving over the last years. When things started, the minimally invasive options was offered for patients who were not candidates for surgery.
Okay.
As things evolved, now many treatment options are the first line treatment for many diseases. And open surgery is still needed for many of the situations where minimally invasive options are not the best for the patients or when it fails. But in many areas we overlap with different specialties.
That's fantastic.
And because we overlap with different specialties, we provide these minimally invasive options in different diseases, different symptoms where patients benefit from it. But at the end, if we're not able to provide these options, or if it fails, surgery remains the gold standard to provide for these patients.
And what are some of the maladies that you find? There's stroke. Do you deal with stroke as well?
We do, but we deal a lot more with what happens in the body, literally from head to toe. So if you are a patient who's having pain in the legs, for instance, with walking or even just lying, you may have blockages of the arteries going to the feet, in which case we can offer treatment through minimally invasive procedures, angioplasty, stenting, atherectomy, etc. You can have similar symptoms with venous problems. So instead of the arteries being blocked, the veins are incompetent. We can, again, through a single 1 centimeter incision, typically treat the veins that are causing the disease. As you work up the body, you can have, for instance, uterine fibroids. A lot of women suffer from uterine fibroids, have pain with menstruation, have heavy bleeding, etc. Typically, or traditionally, the treatment for that has been open surgery.
Sure.
Either complete removal of the uterus or removal of the offending fibroids. But again, we are now able to treat those by entering the blood vessel, isolating the blood vessels that that feed the fibroids, and basically cutting them off and choking off the fibroids, allowing the woman to keep her uterus and either staying in the hospital, either just a few hours or overnight, and then going home and really reducing the convalescent period and allowing them to get back to their normal activities much more quickly.
Please.
So just to add, there are a few major areas that interventional radiology has been really significant in changing patients' care, patients' outcome. Oncology is one of the biggest
That's fantastic.
areas that interventional radiology has played a significant role.
Because women are so afraid to lose their ovaries and lose. I mean, we're all afraid to lose our sexual parts because then it defines who we are. So it's fantastic that women don't have to have their ovaries removed, their tubes tied, stuff like that, to actually go in and be minimally invasive. And also the whole thing with scars. They can still be. Now, when you make the incision, is it through the belly button like the Sills procedure? Single incision, not the Sills port.
It's actually, we go from the groin. Regarding the procedure you're talking about, which is for treatment of uterine fibroids, it's actually, we go from the groin in a very, very tiny incision that doesn't even require any suturing or anything else. It heals along the lines and basically leaves minimal scarring. But I was just mentioning something regarding oncology with cancer, and interventional radiology had a drastic change how cancer is being treated with minimal invasive options. So, for example, in the past, many of the cancers were either treated with a major open surgery with a high morbidity mortality, or with had no basically treatment options, IV systemic chemotherapy. What interventional radiology has changed is basically utilizing the imaging to guide our catheters and our tools and our needles to first make a diagnosis with minimally invasive options rather than excisional open surgery, and then to provide additional treatment options, like, for example, tumors. Now we are able to provide something called ablation, where we can go and either kill the tumor cells either by freezing it like a cryoablation or with a heat like a RF ablation, and we're able to go with a very, very small catheters into tumors inside the liver, for example, and deliver the chemomedicine with a high dose into that tumor inside the liver, rather than going through the systemic bloodstream, and being able to target the treatment that way. For example, this is called chemoembolization, or more recently, we're introducing at this hospital a treatment called radioembolization, where you do similar principle but providing radiation treatment to these tumors, for example, in the liver. We also, interventional radiology had a significant revolution how we treat and maintain the shunt or the fistulas for dialysis patients, where in the past they had a difficult time maintaining the access for dialysis. We maintain it now with minimally invasive options with minimal sedation, without having to go to operating room and general anesthesia, where we maintain and keep these access open. Many other areas, but I don't think the time will allow, but we overlap with many other specialties, but this is the main.
You're like a one-shop radiology stop. That's fantastic. Gentlemen, since the episode is all about heart and valve, give me a health tip that you feel that we all need to know about keeping our heart and valves healthy.
Well, if you want to talk about the vascular system,
Please.
blood vessels, I think the most important takeaway point is prevention. Don't get it in the first place. Control your diabetes, control your high blood pressure, get regular exercise. with those types of measures, you can really cut down on the number of patients who need these kinds of therapies, minimally invasive or otherwise. And if you do develop those kinds of problems, seek treatment early. It's always easier to treat these conditions early rather than later. And we are far more successful, and
Sure.
patients have a far better outcome when they're treated early.
Doctor?
I would say basically saying prevention is the key. I mean, we always focus in so many incidents on treatment, but the best thing is prevention, trying to stay healthy, common sense stuff. Just don't smoke, keep blood pressure low and diabetes controlled, exercise, diet, etc. I would say if we're advanced in the process and we need treatment, look for minimally invasive options, because what proven with minimally invasive options, first, a lot less morbidity and mortality associated with the
Sure.
procedures, a lot less and faster recovery time. Patients will leave the hospital a lot faster. They have a good outcome and definitely significantly cut down on the cost.
And one thing too that we talk about a lot on Healthline is if you have a symptom that keeps on reoccurring and reoccurring, don't be a hero, go to your doctors and get checked.
Absolutely.
Doctors, an absolute pleasure. Thank you so much. And one thing that I do want to say too, though, is Dr. Shaheen and Dr. San have shared with us how minimally invasive procedures and mapping and imaging and radiology can really get on top of something that you're suffering from. It does not mean that it's a cure-all. It does not mean that you don't have to keep your health in check. It does not mean that you don't have to breathe, drink water, eat healthy. The most important thing you can do is take all the takeaways we give you and apply it to living a happy and healthy lifestyle. More when we come back, and I have one question that I want to see if you can answer. How many heartbeats does your heart beat a minute? I'll give you the answer, and I hope you know it, because take a deep breath in, breathe out, get a glass of water, and don't forget to stand. And I'll see you when we come back. Okay, so I asked you, how many heartbeats does your heart beat a minute? Do you know what the answer is? I'm waiting. Okay, I'll give you the answer. It's between 60 and 100 beats a minute. If you are either lower or higher, get your heartbeat on and get your health in order. Don't go away. We have exam room 9, exam room 10, cardiac testing. The entire conversation today has been all about affairs of the heart and everything vascular. If you have any questions about you, someone you love, and your heart, we're a one-stop shop. The Heart and Vascular Institute at Glendale Venice Medical Center will answer everything you need to know. The most important conversation you're going to have is about you and your health, so why not have one today? Have a great week. We'll see you next time.